Welcome, everyone, to Transforming Science Learning, teaching science to address societally pressing phenomena and challenges, the COVID-19 pandemic and systemic racism. Tonight's presenters are Dr. Oki Lee and Dr. Todd Campbell. I'm Kate Soriano. I'll be moderating tonight, and Don Boonstra is here as technical support. And let me start by introducing tonight's presenters. Dr. Todd Campbell is the Department Head of Curriculum and Instruction and a Professor of Science Education in the NEAG School of Education. His research focuses on cultivating imaginative and equitable representations of STEM activity. This is accomplished in formal science learning environments through partnering with pre-service and in-service science teachers and leaders to collaboratively focus on supporting student use of modeling as an anchoring epistemic practice to reason about events that happen in the natural world. Dr. Oki Lee is widely known for advancing research, policy, and practice that simultaneously promotes science and language learning for all students, particularly English learners. Her research areas include science education, language and culture, and teacher education. She leads collaborative research between NYU and Stanford University to develop instructional materials aligned with the next generation science standards to promote science and language learning for elementary students, including English learners. So I just want to say before we get started to all of those in our learning community, you are really in for just an incredible experience this evening with Dr. Campbell and Dr. Lee. And our first presenter is Dr. Lee. And so I want to say, welcome, Oki.
Okay, you're muted.
Okay. I just wanted to give you a 3-second wait time to say, she is coming on stage. So here I am, right? I am so delighted that you are joining us tonight, or morning or afternoon, I just realized. We are going to talk about the systemic racism in relation to COVID-19 in a broader context of the national policy. So when you visit buildbackbetter.gov, which is our current administration, it started from these 4 priorities. I wonder if I can do, okay. So you can see that COVID-19, climate change, and then they are disproportionately affecting racial and ethnic minority groups, and then they also affect negatively of the economy of certain groups. Now, currently there are 7 immediate priorities, and I'm sure that you are so compelled to visit this Build Back Better website today after the session. Those immediate priorities, 9 climate change, equity, immigration, equity, and research, America's standing. Now, the way I think of a storyline of those 7 immediate priorities goes something like this, and you can see that I cannot avoid being an NGSS storyline person, so there. We have a COVID-19 climate and healthcare, which are like STEM disciplines. And then we have a racial equity and immigration. I consider that as linguistic equity. So when you consider 5 out of the 7 immediate priorities, it is about science at the center along with equity, science and equity at the core. And the question that I would like to ask for the participants and others is that what would be the role of a STEM education to make a contribution to this national policy agenda? So in that context, I also would like to think about the role of a science education or STEM education. Now, all standards, all students, and flip. I can say a little bit about all standards and all students, as I was one of the NGSS writers, and also I led the NGSS Diversity and Equity team. So I felt very good about the framework document in NGSS. We can think of it as a traditional, contemporary, and then future, post-pandemic, or what we may call a new normal. So traditionally, when you think about science education, scientists and teachers would define the knowledge of the science disciplines as a canonical knowledge, and that knowledge was codified as typically in science textbooks, and reading and writing was such a dominant theme of a science education traditionally. And when that knowledge of science disciplines came down, some students learned the science and they enjoyed it and moved on to STEM careers, but science did not make any sense to a lot of students. The contribution of the framework and NGS is a contemporary approach that we are trying right now, is that it's all standards, all students. So it is all students. Now, all students are doing what? All students are making sense of the phenomena and designing solutions to problems like scientists and engineers do. So our students are doing science and engineering as professionals do in their professional career. Now, that is our contemporary approach. Now, with the pandemic and all the social upheavals that we are doing, and we are thinking about what would be the new normal. So we are thinking about the future when we get back some normalcy. We will maintain all students. The question is, students as what? And then what would be the future? So the reason I'm addressing this question is that either in the future, someone will tell us what to do, while we galvanize our thoughts and forces to say, this is how we would like to redefine and reframe science or STEM education. So I would like to put that out to the science education community. Science instructional shift. Traditionally, individual learners master science content. Contemporary views is that students are doing science as scientists and engineers do. It is not what knowledge is. It is what knowledge does, and it is knowledge in use. The question is, what would be the future? So I would like to constantly ask you to think about that. Now, today, what we are going to talk about is to propose an instructional framework for STEM education that is centered around the social justice for all students. The instructional framework leverages data science, computer science, and convergence of STEM disciplines to address complex societal problems. And the instructional framework involves the STEM disciplines and STEM education working in concert to address systemic racism. Now, what are we going to do today? There are 3 sections that we'll do. Area 1, using data science and computer science, the students make sense of a complex real-world phenomena and problems. Area 2, through the convergence of multiple STEM subjects, the students make informed decisions and take responsible actions. And area 3, STEM education should promote social justice for all students. And those are the 3 areas of our instructional framework. And we wrote about the framework in the document. Now, in the context of the framework and NGSS, I would like to say that the blue and the orange and the green color are not the 3 dimensions of the NGSS. Now, although they are not the 3 dimensions of the NGSS, so we do want to make clear that we are using the storyline of how to develop the storyline to teach a unit like this. So we use the NGSS storyline philosophy. Now we are going to start with area 1, data science and computer science. So you have seen all the spaghetti lines of going up and down and wiggly and all that. So what does that mean? Data science and computer science enable students to make sense of a phenomena and complex societal problems in the global context to address the pandemic. Pandemic meaning global. So we are going to talk about how students find the phenomena compelling to figure out. That you see that the approach of the making sense of phenomena and design solutions to complex problems. Now, in figuring out the phenomena and the problems, we are going to use one very, very prominent data source by Johns Hopkins University Coronavirus Resource Center. Okay. And here is what the resource center looks like. All right, before Kate shows you how to do it, you can see that on the top left, global cases. Can you read that large number? It is not 12 million, 124 million global cases. We are just celebrating or commiserating 1 year since the lockdown, about last year of this time. And I remember, oh no, we would not get to 2 million. Well, that was like history. Now, on the right side, you see global death. It's a 2.7 million deaths globally. Now, in the global context, there is a breakdown of the nation. So when you see the US, do you see that? As of today, right now, we have 30 million cases. In terms of a global death, out of a 2.7, we have 543,000 deaths. Now, when you think about the math connection, you can do some estimation of 30 million out of 124. What would be the percentage of US cases in the global, in relation to the global cases? And that would be about, you could say about 25% estimation. Okay. Global death, 543 out of 2.7 million, and estimation rounding off, you would say about, that looks about 20%. So that's what we have. Worldwide, the data show confirm the cases and death. In the US, confirm the cases and death. In New York, which was the epicenter of the virus about this time of last year, New York City alone was about the 25% of the cases and death. So confirm the cases and okay. Now you may be wondering about what would be the proportion of the US cases and death compared to the world? All right, drum roll, please. Not that we are excited about it, we would like to know. No. The confirmed cases in the US constitute 24% worldwide, and the death in the US constitute 20% worldwide. Now, the US population is slightly over 4% of the world population. So you just take a second and say, wow, the US has 6 times more of the percentage of the in world population, 4% population, but 24% of cases. The death rate in the US is 5 times of the death rate in the world. And US is the most affluent nation in the world. So English is my second language. And I would say, whoa, the US is an overachiever by 5 times and 6 times of the cases and death. So that's the power of the data. Some of you may think that, wow, the data are beautiful. But then the reality is really sad. It's a very mixed emotions of science and the reality. So Kate.
I can help jump in here too. I just building off what Oki said, I think it was one time in November or December, I looked at my county, which you're going to get ready to look to do at the Johns Hopkins website. I looked at my county in Massachusetts where I live, and it was the same number of cases as a few countries. So it just like, I think that also paints the picture of the disproportionate number of cases we've had in the US. So we want you, our first way to orient students toward real world phenomena, we want you to begin to make sense of data in ways we've imagined for students. And one way to do that is to go to the, we want you in a group to go to the coronavirus US map. Kate's gonna take us to that, I think, and show it to us. When you get there, you're going to work in a group, but it's going to be not in a breakout room, but on a in a Google Doc. When you get to the US map, you can click on your state territory. I think Kate's going to do that. She could pick her state or my state, whichever, Wisconsin. And then it'll give you the choice of your counties. You can find your county. If you click on that, it'll take you to the map of your county. It'll outline it. And when you click on the county, your county, it'll provide you with an infographic, and that'll give you data from your county. So it gives you more than data, it gives you some demographics from your county, but it also gives you the last 14-day trends in your county. So we want you to take a screenshot of that, put the screenshot in the Google Doc, and then you can look at yours, try to make some put down some things you notice about your county and the cases in your county. And then other people in your small group will screenshot theirs and put down some things they notice, and you'll get a chance to look across some counties and make some comparisons. So we're going to spend about 8 minutes letting you explore this data so you can, like we envisioned for students, make sense of coronavirus data.
Thanks, Todd. And we are dropping the links now to Google Slides, and you're going to choose the link that corresponds to your birthday month. So as Todd said, when you arrive at your slide set, what's going to happen is you're going to go to the first available slide, and you can see that I stole the first available slide because I do have an October birthday, and pasted my county onto that slide. And then I'm just going to spend a little bit of time sharing some, just for me, some noticings about the data in my county. And then we'll let you know when 4 or 5 minutes have passed, and we'll ask you then as a group, which goes by color code, to join your group members and just share some similarities and differences as you observe the data for 3 counties in your group. So again, you're just going to scroll down, grab the first available slide, get your name on it to claim it, and then you can go back to the US state map, get that screenshot and paste it onto your slide. So I'm going to stop talking so that you can concentrate. And if you have questions, please place them in the chat, and we can provide you some guidance from there. All right, so that was about 6.5 minutes. And if you haven't already, do take a moment to look at other infographics posted by your group members. And before we pull you back into the whole group, would you note one similarity or difference that you saw? You can do that on the last slide of your group slide set. And we just have about 70 seconds. So you only got about a minute to do so. And this is something you can revisit, but go ahead and see if you can note a similarity or difference before we call your attention back to the whole group. Okay, Oki and Todd, I see groups are just getting started with that task, and I want to remind them that these links will stay live forever and will be able to come back. But I'm going to go ahead and stop sharing my screen and let you continue with the presentation.
Thank you. Okay. We hope that can we see the whole screen? Okay. That the data, you find the data compelling and also relevant to your local area. You can imagine that students from many other different countries will say that, what about my country? What about my family? Which is related to the cultural and linguistic diversity of our student population. Okay. Small group. Okay, did we do that? Yes.
We did. Yes, we did.
These are some of the data sources that you may find interesting. So there are 2 research centers, and then there are news media, and all the news media are committed to providing the up-to-date information for the public. We are going into then Todd.
Great. So thank you. So I'll add, as Oki and I started working together on this last summer in the middle of the pandemic, or more near the beginning, we started trying to think about, like, how could we think about what we're learning as a society, and also how that might inform what we do in science classrooms. So it oriented us to trying to find space where our science classrooms could intersect with societal concerns and ways that students could make sense of those societal concerns. And Oki shared the first one, which was letting students make sense of COVID-19 with data science, large data sets that became available, partially because of transparency. The next part that we found useful was as students begin to make sense of large data sets, they start to find patterns and trends, and they start to describe those patterns and trends across counties or wherever they're looking. And then they might want to start thinking about how to talk about and explain those patterns that they see. So one thing we're looking for as science teachers is ways to put ideas on the table so that students can begin to think with those ideas. We don't want to prepare explanations for students. We want to put ideas on the table and let students use those ideas to construct and critique their own explanations. So one way to do that was through computer science. So we found, I think I don't have control.
Yes, you do. Right there.
Perfect. Oh, I lost. Thanks, Don. One way we found to do that was a wonderful Washington Post article that was published early on at the beginning of the pandemic. Let me see. And I'm there. Just a little delayed. So we're gone too far. The Washington Post article helps students begin to understand how to possibly flatten the curve, what kinds of things might lead to and prevent the spread of the virus. What's really interesting about the Washington Post article, it is the most read Washington Post article in the history of the newspaper. And we looked up and we found out the Washington Post has been around since 1877. So I think that's significant. So people, it really resonated with people and helped them try to understand the pandemic. So what we would like you to do is we would like you to look at the computer science simulation in the Washington Post article. We'd like you to go through it in alone time. So go through the article and read about the simulations and what they're helping you try to understand. And then when you're done with that, you'll, in a small group, we've created a Google Doc, or Kate did, that you can go into and you can write some things that you noticed as part of the simulation. So I think, Kate, do you have any other things to add?
No, I'm going to go ahead and share my screen so that everybody can see the article. And then Michelle, who is here, is dropping the link to get there. So here is the article. And if you scroll, you'll find the simulations that Todd is referring to. So here's the first simulation. So we want to give you some time to do that, about 4 or 5 minutes, and then we will call everybody back together and then drop those Google Doc links so that you only have to worry about one thing at a time. So go ahead, follow that link, and I'll grab your attention in about 4 minutes.
And we do think it's worth like trying to read through, and so you understand what the simulations are trying to show you.
Okay, I'm going to gently call your attention back to the chat window. And Michelle is going to drop the links to a series of Google Documents. These Google Docs, you're going to choose your link by your birth date. And I'm going to show you one of them. So here is what the Google Doc will look like when you arrive. And when you arrive, you're going to take the first available cell and type your name into the first available cell. And then if you click on the group name, you can quickly navigate to a table where you're going to share your noticings among 5 other participants in tonight's learning community. And you don't need to comment on each other's, but as you're typing yours, you might look to the left, look down, look up, and see some of the other noticings that people made when they were looking and observing the outcome of those computer simulations. So let me get those. Oh, here they come. Thank you, Michelle. So we're just going to take a few minutes, just going to share your noticings. Again, put your name in the first available cell. And when you click on the group name, that'll get you quickly to where you need to go, and just share some noticings, your observations of the different simulations. Yes, and I'm sorry, do fill in from left to right, first available cells, so that you're not in a group all by yourself. So work from left to right to complete groups before you start another group. I just want to make sure you're not all alone. Okay, we have a high engagement in sharing those noticings, Oki and Todd. So I'm going to encourage everybody to, again, just look to the left, look to the right, look up, look down, take a quick glance at some of the shares. And then in about 30 seconds, I'm going to call you back, but just remind you that you will have access to these tables after tonight's presentation. So you can go back and see some of the shares of the other people in your groups. So Oki, I'm going to give them a little bit more time while I stop the share and Don brings the slides back up.
Keep going. The response is amazing. Yeah.
So I think we can go ahead and advance the slide, although I'm
Okay.
struggling to do that.
So it's mine. Kate, okay. It's,
Let's see that. I don't have control. Oh, good. Okay,
yes.
great.
The responses are amazing. Thank you so much for sharing your thoughts. It's fun. Now we have spoken about science, math, data science, and computer science. And we have the basic command of STEM disciplines. And we are going to put them together as a multiple STEM subjects to think about how to make informed decisions and taking responsible actions for this complex societal problem. And when we think about making decisions and taking responsible actions, individuals that can do their own part as well as each society. So we are going to think about each individual doing their part. There is a Reuters article about what it takes. Okay, about this time. So when we do the COVID-19, we say that wear a mask, wash your hands, and keep social distancing. Another idea that there was, the proposal was contact tracing, so that we can identify who are the people and then how to keep control of the people in terms of infections, social distancing and contact tracing. Okay. I would like to ask you to take a look at this digital contact tracing. And it's really intuitively very interesting. So you see subject A has a COVID-19 infection, no symptoms. And the person is at home, and A and B, two people at home. And then the person is taking a train and in contact with the C and D, and then go to work, and then in contact with the E, F, and G. But then the person has somewhat remotely, not nearby, but not close, with an H and I, and then the person comes home and then back again with the person B. The following day, the person awakes with a fever, and then the person reports symptoms and requests a home test, and it turns out the person has a positive COVID-19. And then that instant signal says that because A, the individual was in contact with the B, C, D, E, F, G, then those people have to be instant signal saying, okay, decontaminated. Now H and I, who are nearby but not close, would be doing social distancing. And this is the idea of a contact tracing. Wow, that's really interesting, isn't it? So we would like to see something more complex in real society. When I say real society, I mean 51 million people of South Korea, more than one family. We're going to look at Reuters information. Kate, show the article. So here is a Korean clusters article, very early around February, I believe, right there. Now you can see that in South Korea, they started a contact tracing from patient number 1. I hope that you're going to say, wow, patient number 1. Patient number 1 was infected by someone from Wuhan. All right, that was another political issue. Now, one long line is 100 people. So you can see that patient number 1 had about 50 contacts. Patient number 2 had about 70 contacts, 3. Okay, so it's about 80, 100 and going down. Now look at something, married a couple, and there is, someone had 423 contacts. And then the next person had no contact and the other person has only 2. Now the bottom is then another person has 450 contacts. And then I think they learned a lesson and people were very cautious and not limited social contacts. And then look at patient number 31. What does it say? 1,160 contacts. That's what we mean by super spreader. And that's the exponential spread of the virus. And that person is named the patient number 31. And the question is, do you want it to be like a patient number 31, or don't be like a patient number 31? The reason why this contact tracing is really very impressive to me, and I'm going to say it, that this is done in Daegu, South Korea. And you know what? My family members live in Daegu, South Korea. And this is what I mean, that this is a global phenomenon, and students are going to relate to my family in Haiti, my family or something. But this is a contact tracing, which is a very controversial in terms of privacy and all that, but it is possible. And you can see that it's a super spreader individuals or super spreader events. Whichever you go, that's exponential growth. Okay, the next slide is me, actually. Don, it's a Kate. Okay. The next one is that now that we spoke about what individuals can do by including isolation in extreme cases, but social distancing, I'm trying to go. Now we can think about using multiple STEM disciplines to think about what a society can do. So each society, you can think of the US, Great Britain, and France, and Korea, Japan, Australia, and New Zealand, what each society can do. So we are going to visit another data source. It's our world in data. And here is a cumulative confirmed COVID-19 death, and you could find the information of per million and all that. And Kate, I would like to ask you, here, you can see that it's a cumulative confirmed death of United States, which is over 500. I think we have 543,700 something. Look at the bottom as if like it's a flat. There is on the bottom, you have a Canada, like, what? And Canada is our neighboring country. Do you see the gap of the cumulative death? You can also see the US has never flattened the curve, and you can see a sharp increase around November, end of November through February, like that. And that's a sharp increase. So Kate is going to show you how to navigate this data source so that you can actually navigate the data source yourself. Here is our world in data. Kate, would you show the death panel? Okay. So you have a different panel and there is a death. And go down. And it'll have a different types of data. Confirmed cases of a confirmed daily per million, cumulative, there. Not the million, cumulative, right there. So Kate is going to show you how to navigate, which is not intuitive. Go to add country. And then there are, take out India, United Kingdom, and Germany and France, and just keep the United States and Canada and click, and there we go. That's the graph that you have. You can do the chart, map, table, you can even have Excel data. So now that you know how to navigate, we are going to ask you to navigate this data source by looking into either certain nations or groups of nations. So Kate, would you go there, the instruction, is that the instruction? World in data. Kate,
Yes,
Alonzo.
yes, I'm just typing in, I dropped the link to the coronavirus page, and I'm just typing in the chat that you're going to choose deaths on that landing page. And then you're going to scroll down to find cumulative confirmed COVID-19 deaths. And the directions are to choose a country or a group of countries, and look at those countries comparatively on the graph. And we're going to give you a few minutes just to play So you can pick a few countries and compare them, turn them off, turn on a few different countries, compare the data over time. And then we're going to call you back in about 4.5, 5 minutes and send you to Padlets to share some noticings. So again, I'll stop talking so that you can navigate to this page. If you have any questions, please write them in the chat and we'll respond to them quickly to get you to the right place. Okay, so I hope that everyone was able to navigate from the main home page of Our World in Data to find the cumulative confirmed COVID-19 deaths. And you can see on my screen now, I have the United States, Mexico, and Canada for comparison. But what we're going to do now, Michelle is going to drop links to a Padlet And this Padlet, you're going to choose your Padlet by last name. So the first letter of your last name. And when you arrive at your Padlet, the prompt is across the top, and that is, what patterns do you notice when making comparisons between the numbers of COVID-19 deaths across nations? And if you haven't used Padlet before, you can add a post by moving to the lower right-hand corner and clicking on the plus button. Another way to do it, if you want to skip the plus button, is to double click anywhere on the Padlet board. So again, you're going to navigate to the Padlet using the first letter of your last name, and we're going to give you a few minutes to share your noticings about the patterns when you make comparisons between the numbers of the COVID-19 deaths across nations. Okay, and Todd, again, we have really high engagement in the post, and really a lot of people looking at some of the same countries, but from different perspectives. So uh, I'm going to let me know if you'd like me to page through and share a couple of the other Padlet screens before we call everybody back, or would you like to we can remind everybody that these links will remain live forever, and you can come back and revisit the Padlets. Oki, what would you like to do? Should we return to the slides?
Todd, your turn. So let's say yes. Return to the slides.
Yes, I did notice. I love the comments, and I think I saw things I didn't try myself. Oki and I tried a bunch of different comparisons.
Okay.
So, let me see. Oh, there it is. So that takes us to the last and potentially as or more important than other areas. We also noted, so in the middle of the pandemic, in the middle of this last year, we saw the police brutality connected to George Floyd, but we also began to see the disproportionate impact of COVID-19 on ethnic and racial minority groups. And so we wanted to make sure that that became apparent to students as well, and that STEM disciplines and STEM education could work in concert to try to address systemic racism by making it more apparent and thinking about the causes and thinking about the solutions. So in this part of our framework, we tried to think about how can we position students to begin to attend to systemic racism, to become aware of it, develop their critical consciousness of the disparities within our country, and especially in connection to COVID-19, where it became really apparent. One way to do this would be to orient, like we've been doing before, orient to some of the data that emerged. I know I saw in the chat earlier when you were looking at the Johns Hopkins, it wasn't disaggregated by data, by race and ethnic groups. CDC has published information about that. The Atlantic had a database as well. You can see here, just going to deaths, the deaths, if you're American Indian or Alaskan Native, you're 2.6 times more likely to die than the white population in the US. If you're Black or African American, 2.8 times, Hispanic or Latino, 2.8 times, almost 3 times more likely to die if you're from one of those racial and ethnic minority groups. And so what we know is, if all other things are equal, the disease or the virus, not disease, the virus would spread similarly from one person to another. So there's something baked into our system that makes it so that some groups are disproportionately positioned to be affected negatively. So why is that the case? We can look at some reasons for that. Chief among those, I think, is the wealth gap, or the income gap, or the wealth. So because you can see here in some of this data, like the white median income, net worth, you can see it compared to Black or Hispanic. It's tremendously different. So the resources are not shared proportionately within our society, especially in the US. There's other articles that came out in public media that also tell the same story with data. We found those as well. And so the last part of our framework would say systemic racism manifests itself disproportionately, especially with higher rates of COVID-19 deaths and cases, and it happens to racial and ethnic minorities, low-income communities, inmates, and other marginalized groups. And we want to position students to be able to recognize these things. I think it would also be similar, and it is, if you think about even climate change, what you would see, who's being disproportionately impacted. So we want to find ways to position students to recognize this, to begin to reason about it, why it exists, and then propose justice-centered solutions for how we might attend to it as a society. So that was here's a summary. So we use multiple STEM subjects to make sense of complex phenomena that matters to society. And then we address systemic racism, or try to find ways to address systemic racism as part of this work, and doing it with students. So what Oki and I did was, first we thought about it. We looked at these amazing tools that were emerging, dashboards that weren't government funded, because government funded dashboards weren't available. We looked at computer simulations that were teaching us a lot about COVID-19. And then we looked at data that began to become available to demonstrate the disproportionate impact of COVID-19. And then we tried to think about how do we take our conceptual ideas and put them into lessons that students could encounter in classrooms. And we began to develop daily dues, with NSTA daily dues, which are 1 day, 2 day lessons. You can pick them up and use them in person or online at home as well. So our first one was about how can you make informed decisions to keep yourselves and your community safe. In this one, you experienced part of it when you looked at your county's infographic. So that was our first daily do. We just had another one come out, I think yesterday or the day before, and it was looking at the disproportionate data in different states to think about whether or not there was evidence to support this. And there is. I killed the punchline. We're working on another daily do where we unpack the causes of these differences. We've done some of that in daily do too, and I'll show you all four of these. And then we're going to finish with at least one more that looks at like the structural racism that's apparent in the US and what kinds of things policy-wise we might need to think about if we're going to address these things, and we should. So our first daily do you experienced, we had students reasoning about their own county's data and another county's data they might have been interested in, making comparisons. Then we wanted to position students to do something, take some action or make some recommendations. So we asked them to take their county data and take the CDC guidelines for the safe opening of schools and to come up with some recommendations for their county about when their schools would be safe to reopen. So we're trying to position students as sense makers, legitimize their presence in their communities. The second daily do, which came out this week, has students look at the same data, but represented in different ways to begin to make claims about the data. So this one particular is New Mexico. If you look at the first one, it's hard to pull out the differences. You can see it happening, but you don't really have ways to make fair comparisons. The second one here has cases per 100,000, and that green line that's longest is the American Indian Alaska Native. You can see how disproportionately they're impacted in New Mexico. As part of that daily do, we also had students pull different states. At the Atlantic, they have all the states that are reporting disproportionate or reporting the disaggregated data. Once students found these differences, we positioned them to read through news articles that had some of the causes for these disproportionate impacts, things like definitely income, but also multi-generational, that income gap leading to multi-generational habits living together, smaller quarters, so they're unable to do the social distancing. Places like Native American reservations that might not even have access to clean water aren't able to do the hand washing that's recommended. And then we ask students at the end of this one to come up with some proposed justice-centered solutions. So if public transportation is a problem because a disproportionate number of racial and ethnic minorities are essential workers and they have to take public transportation, students might reason about how do we make that public transportation more sanitized so that the spread doesn't occur, as just one example. The next daily do we're working on now is to kind of work to even further unpack the causes of the disproportionate impact that you can see in the CDC data. And you can see here, these are things I mentioned before: wage disparities, multi-generational living arrangements, essential workers, incarceration rates. And then we come back to, this is what I think was really striking to us, is the CDC's guidance is here: wear a mask, stay 6 feet apart, and wash your hands. If we only did that, and we all did that diligently, we would still have this. We would still have the disproportionate impact on communities. It might be decreased, but the disproportionate impact would stay where it is because we haven't taken care of our structural deficiencies when it comes to resources and how they're shared among our citizens. And then the last daily do is looking at structural racism within our society and thinking about how policy level changes and actions are necessary to really get at the heart of what's causing these issues. And then some ways to think about that. And we're working on this. So this is a plan and action that hasn't yet been fully cooked. And then I'm back to Oki.
Unmute. Okay. So we would like to come back to the broader context of why does it matter, in the sense that when you think about traditional, we're talking about typically before the framework, which was up to 2010. And then contemporary starting from the framework and the NGSS. So we're talking about the decade of the 2010 to 2020. And now the future stays at the same time as the contemporary. So we do not know exactly what the future holds. And actually the National Academies of Sciences and Engineering and Medicine is having about the view of what's going to be the future of a science education. As we, individuals, as well as a society and communities are thinking about what would be the new normal when we come back. So I'm asking the science education community, specifically in STEM education community, broadly to think about what would be the future like. And we are thinking about the future to make a contribution to the broader, the national agenda that we address the COVID-19, and Todd mentioned that it may apply in a comparable way to climate and health, which are the science or STEM. And then the how to we put equity, racial and immigration, linguistic equity at the core as a part of the economy and restoring the American global standing. So we're situating it in the larger context. And then the question to all of us is what would be the roles for STEM education to capitalize on this century event, which will change the society, unthinkable. And then envision a new and hopefully a better normal for STEM education centered around the social justice for all students, so that STEM education has a critical role to play in collaboration with the STEM disciplines in addressing equity issues, not as accommodations or oops, we forgot, but at the core and take a seat at the table so that science and equity are together as a part of the national policy agenda. And we are going to open up for questions and answers. And we have about at least 10, 11 minutes. Right. So Kate.
Thank you, Oki. And thank you, Oki and Todd. I'm going to get right to the questions because they're rolling in. And I want to start with an early one. How have people framed activities and discussions around COVID while being mindful of students' experiences, their trauma, their loss, in their own families and communities?
So I would like to take that question. And we take it very seriously because it's our daily life. And we are all exhausted. So I would like to ask a question of this. We wanted to use the knowledge as a power to understand why we are exhausted and struggling. We're not addressing it because it's too emotionally challenging. That's a question. Do we want to address it and confront it and use the knowledge as a means to understand or not? So that's one question. The second response to that is that we were working with an elementary school teacher who is teaching STEM, and she gave the option for her 2nd through 5th grade students of what the societal problem that you would like to address as a part of engineering design. And she was just stunned that many of her students, second through fifth grade students, were interested in addressing COVID-19 because that is part of their life. And when students decided to do the engineering of COVID-19, another part that she was really stunned of not only the agency of her elementary students, but many students were very committed to helping others, like how to build the sanitization station so that we can help essential workers, or how I can help. So obviously students are really thinking seriously about the lives that they have. And the question is, do we respect the life and invite them as agency or not? I think it's an educational question that we need to think about. Todd, do you have anything to add?
I think you captured it. I think it's, I think we'd have to be really careful, like Oki suggested, but I also think if we don't orient our students to it, and our society to it, like we'll never address it.
Yeah, our teacher collaborator, in fact, she was thinking of, am I going to address COVID-19 or not? But her students demanded they would like to do it. So she enabled her students to take up and take on.
And I do, like in that example, and we sent an article with that teacher in to NSTA. I did also appreciate like the way the students oriented toward it was ways that they could help. So they would create like COVID cleaning stations in their homes. So it wasn't, I think the way they oriented to it and took on the task was in ways that made them feel like they were contributing to their family and their health.
Thank you. Another question from Karen, although there's a lot of conversation happening in the chat around this. Is there any research out there that ranks the different contributors to susceptibility among disadvantaged communities and shows which are the most important issues? And I'm going to drop Karen's question back in the chat, Oki and Todd, so that you can see it.
And let me try. I'm following the immune systems and all that, and I think it's really an important issue. So here's how I would respond, and I don't have the expertise to be able to respond in an intelligent manner. So I would like to admit my lack of knowledge. But the way I would think of it is that this complex societal problem will involve multiple factors to explain and to address, to solve. So it's not just one, but multiple. So I consider that immunologists and the medical field and scientists will find out that the immune systems and our human body, while the sociologists and others will find out the economic gap and how that affects or the incarceration rates of others. So we are in no way saying that some factors are more dominant or we know how to rank order them. Not that. It's just a confluence of factors of individuals or the groups or the society that affect. So in our issues, society, make issue involves. I think it'll be really important for the COVID-19 task force to have doctors and medical doctors and scientists on one hand, and then the sociologists and people who do structural issues. And I demand, and I wish we had that STEM educators at the table, that we have a say.
And I would just add, like, I think there certainly could be those differences in the immune system. I think I've read enough that talks about they're not really differences in racial groups other than what we've made. They're human conditions that we've made. So I would just orient back to or think about like what we have been told about from the CDC mask wearing, social distancing, keeping our distances, and where that's not possible, like we can understand why it's not possible. It's not possible in some communities because they're disproportionately essential workers, so they're disproportionately exposed and exposing their families. It's not possible when multi-generational living happens with multiple essential workers. So I definitely think we could look down that path, but what it feels like it does is it absolves us from the responsibility of making our society more just. And I don't necessarily, like, I definitely want to see what's out there and be very open to that, but I also want to address the things that we can tell and we can find evidence of.
Thank you both. I'm going to keep moving because there are a lot of questions out there. So I'm going to start with Kirk's question. And Kirk asked, was there anything that students read or engaged in about biases within the healthcare system that might yield differing outcomes in minoritized communities? So you talked a little bit at some of the differences, Todd, just now about the living situations, the number of people who are frontline workers, accounting for some differences. But what about the biases within the healthcare system itself? And I'll go ahead and redrop that question so you can see it in the chat window.
Yeah, and I don't know how much expertise I would have to speak to that. So if Oki wants to pick it up, she can. I other than I've read news articles that talk about, I do think you could find evidence that when healthcare is not available, where it's not available to those in low wage positions, and those are disproportionately taken up by racial and ethnic minority groups.
In terms of disparities of the society are written quite a bit and talked about in the media and in the public spheres. What are the causes? Well, it's one thing to think about the phenomenon and what are the causes and underlying. Now that gets quite complicated. And I feel like I'm going to be a little bit of a Dr. Fauci that we do not know enough yet because we are trying to figure out to explain and that solve the problem. Now, having said all of that, I'm looking at the chats, and if nothing else, two comments that I would like to offer is that one, we are provoking the science education and STEM education community to think about this issue and raise the issue of what would be the role for us as teachers, for us as adults. So that's one, as adults, as just educated adults, and then as educators, science educators. The second question is that there are certain things that adults talk about, and there are certain things that science education educators talk about. And then the next question is, how do we present this information, the richness of the data science, the computer science, and design, all of those for the students in a storyline, in a way that students at different grade levels can understand and appreciate, and also be mindful of the emotional trauma and for our students and how to develop the storyline. I think it depends a lot on your understanding of your students, how much that you feel comfortable, how much that your students will feel comfortable. The reason I'm saying is that the elementary school teacher that we are doing the writing together, we were just stunned that her students were so engaged in COVID-19 and helping others. So I would say that STEM educators and science educators would be the best people to make decisions about with your students. But at least if nothing else, we are provoking the ideas to come out.
I do appreciate Oki's comment of like recognizing the expertise of science teachers in classrooms who day-to-day work with students and have expertise to bring to how to address these issues.
And we are somewhat provoking these issues because when you think about COVID-19, climate, and healthcare, these are all STEM disciplines. And I hope that science education community and STEM community will take a seat in decision making so that we represent the future generation of the students and their parents. So I'm pushing.
And I'll throw in and challenge us. I know I'm enamored by NGSS and reasoning about real world phenomena, developing models to explain things we don't know and developing our knowledge over time. But what I realized over the last year, at least, is there's a difference. We should be reasoning about why tanker cars implode or why we're able to drink out of a straw, but we also can and should reason about those societal issues that really matter to our students and our communities. And so we need to, while we're building on what we already learned from NGSS, we need to push ourselves into those social arenas to use science as this tool to make sense, not with the answers, but with pieces of the answers that can be applied.
Todd and Oki, thank you so much. And I'm afraid we have reached the end of our presentation, but I do want to remind folks that Oki and Todd have graciously agreed to stick around and to answer a few more questions after we return from the survey. But thank you so very much to Todd and Oki for tonight's presentation, and not just tonight's presentation, but for the 2 published daily dues and the upcoming daily dues that are available to all teachers. The open educational resources, and I really encourage everyone to check those out. I will drop those links again. I have dropped them in the chat while Oki and Todd were sharing, but thank you so much for your expertise and your time with us this evening. I want to share just a few things. A thank you to our learning community. Again, we're just minutes away from dropping that post-program survey. It does inform the choices that we make and the offerings that we share. So please do fill it out. Again, it also is your confirmation of attendance in tonight's web seminar. I'm going to go ahead and drop a link again to the collection of resources, and you'll find within 24 hours the recording for tonight's web seminar, as well as the links to the tools that we use tonight. So you can revisit those, you can make copies of the templates and use them with your own students. We do have the spring conference upcoming. We're going to do things a little bit differently this year. Each weekend, each long weekend is devoted to a different grade level. So if you work across multiple grade levels, you'll have an opportunity to not have to pick and choose that concurrent sessions, you'll be able to attend more sessions over time. Also, Oki is one of our lead presenters in an upcoming book study on the cross-cutting concepts that is coming up in May, along with the release of a new book about the cross-cutting concepts to support us in using those cross-cutting concepts, which are very powerful, but haven't been spoken much about. So we're looking forward to that series. And we're wrapping up our first What is Social Justice Teaching in the Science Classroom Series 1, and it's being offered again this summer. So please join and be part of that learning community where you can continue to explore, as Todd said, moving, not just counting all the things we're doing or have done in the past, but also moving forward into issues of social justice and the role that science plays. And one last thing, upcoming web seminars, these are free to the public. And let me drop that link. If you are interested in learning more about the daily dues, then you can join Tricia Shelton on Tuesday to learn more about the daily dues and implementing them in both face-to-face and virtual settings, as well as a science update, 2 science updates coming up in the very near future. And we hope you check those out and let your friends and colleagues know. And I think and a final thanks to the NSTA virtual team. Without folks behind the scenes, these types of programs would not be possible. And this does conclude today's program. Don, would you please stop the recording?